You're listening to This Week in Central New York, and I'm very glad to have a couple of rising stars on today's show. Bassett Healthcare Network recently announced that two of its leaders have been recognized as rising stars, and we're going to be talking to one of the rising stars right now in Deanna Charles. First of all, Deanna, welcome to the show. How are you?
I'm doing well. Thank you for inviting me. It's a pleasure.
Deanna, when you got word that you were named one of the rising stars, Becker's is proud to recognize the rising stars in healthcare. And when you were announced as one of the rising stars, what was your initial reaction?
I thought they were joking. To be honest with you, I was so surprised. I was very honored, but really, truly very surprised. It truly is an honor to be recognized and to recognize Bassett and all the wonderful things we're doing here. So to be not only for myself, but to be seeing Bassett's name in this, it's just truly been an honor for me.
Deanna is Senior Vice President, Chief Ambulatory and Transformation Officer at Bassett Healthcare Network. What is a Chief Ambulatory and Transformation Officer for the listeners out there that don't know?
Really, what I do on a daily basis is support my teams who support patients directly. You know, I'm a servant leader, and so my role is to support my leaders throughout our whole 9-county geography and all of our ambulatory clinics. So your primary care, your specialty service clinics throughout our entire 9-county geography. My job is to support them and to help our patients get the care where they need it and when they need it.
One of the challenges I would think, Deanna, is the absolutely large area that you guys cover.
We phrase it as it's almost the size of the state of Connecticut. That's our square mileage geography. It's so vast, and I think sometimes people don't realize how far we're spread to try to bring those services as local to those communities as we can. But yeah, it's the geography, the commuting challenges, right? There's no straight roadways, but there's also challenges with internet connectivity, you know, trying to bring that service more closer to the patients and in their homes. We do run into internet connectivity issues. Some of these strong rural communities don't have access to high-speed internet. So that does layer in another challenge. So our clinic has to be located in a place where people can get access to care.
And please elaborate on the strategic planning aspect of your job.
One of the biggest challenges we're facing in healthcare at Bassett and everywhere is the continuous need for services continuing to grow and staffing challenges. So, you know, how do we continue to provide that quality care and that quality service to our patients that they've come to expect and that they need, you know, with perhaps less resources? So trying to get creative in order to make sure we can take care of our patients each and every day and meet the needs that they have. And that's a lot of the strategic planning in focus, especially for myself throughout 2023.
I know based on your first answer, Deanna, it seems like you're very humble, but to become Becker's rising star, you have to be very good at what you do. But what is the other key ingredient that makes you so successful other than you just being very good at what you do?
It's the team. I truly feel that, you know, I'm at Bassett for the mission. I'm a mission-oriented person. And so being a part of Bassett, being a part of a mission-driven organization, being surrounded by amazing leaders and an amazing team is what helps drive success. And honestly, I am a very humble leader. You definitely caught on to that, but truly, at the end of the day, it's a team, and it's also not just a team, it's a family. And so I really think that is the key driver, is having a supportive team, being there for one another, and being like a family.
The question I'm sure you get a lot, Deanna, as far as what you're directly involved in with you're responsible for all ambulatory and outpatient operations. How has the fact that the pandemic has calmed for the moment and, you know, compared to 2020, 2021, we're kind of moving into a better area here. How has that helped what you do?
I think it's helped in terms of how we deliver care. So if I think back to a couple of years ago when we were in the height of the pandemic, you know, we were having to see patients outside in tents. We had tents set up behind our buildings as drive-through. Our staff were in layers of clothing to try to keep warm in the middle of winter, to try to swab our patients, to identify who had COVID so people can keep themselves safe, keep their families safe, keep the community safe. And, you know, our teams really had to sacrifice a lot, but build resilience to where we are now, which is we can see these patients back in our clinics. We can get back to, you know, the care that people normally receive inside a clinic, inside a facility, inside an exam room. We truly have come a long way from the pandemic of outside care to being able to go back to seeing patients in our clinic. It's made a tremendous difference for our staff.
Since we already talked about strategic planning, Deanna, do you have a set plan for 2023, or is it one of those things where you kind of have to tackle things day by day in the profession that you work in?
It's always a combination of both, right? There's always something brewing on a daily basis, but we do have strategic plans. And, I would say, again, my focus for 23, I referenced before, is really trying to improve our access to care. We continue to have less staff, less practitioners, physicians, and patients still need our care. And so continuing to focus on how we get creative to meet the needs and improve the access to our care for our patients and our communities, it is my focus for 23.
And let's talk about Henry, who is also named a rising star. Why do you think that is, Deanna?
Henry is not only a colleague, but a close friend of mine. I've had the pleasure of working side by side with Henry. We've been here almost the same amount of time at Bassett together. I think I started about 6 months before him. He brings a lot of the same core values, mission driven to the organization, but he's very forward thinking. He's come from other hospital systems that breathe new light and new ideas into our organization. Just seeing what he's been able to create in our organization, driving telemedicine initiatives, especially in the height of COVID, making it accessible to everybody very, very quickly so we can continue our care for our organization and for our patients. I'm truly not surprised at all that he was recognized in Becker's for all the work he's done since he's been at Bassett.
Deanna, an absolute pleasure talking to you. Thank you so much for your time.
Thank you.
That is one of the rising stars at Bassett Healthcare, Deanna Charles.